Hello, everyone. I hope you are all doing well. My name is Angela Hung, and I'm going to be presenting on how various factors impact mental disorders in the elderly around the world. A little bit about myself before I start. I'm currently a rising senior at University Preparatory Academy in San Jose, California. My hobbies include swimming, baking, traveling, and playing the piano. And in school, I am the president of the Red Cross Club, an academic tutor, and a link leader and mentor to incoming freshmen. I want to start off with a little bit about my own experience with my maternal grandfather's mental disorder, which deteriorated following his entrance into a senior care facility, and the impact it had on my family. So, following his passing, the pandemic made it difficult for my family to travel overseas to take care of my maternal grandmother, who is now living almost alone. And this terrible circumstance led me to realize the unfortunate reality that elderly with mental disorders and their family inevitably face. And in response, I initiated my volunteer project called Therapy for Seniors, where I hold virtual piano performances for elderly all over California with the goal of improving their mental health. And throughout my numerous performances, I have experienced firsthand increases in the elder people's mood, which manifested themselves in positive body language and increased verbal interactions. So before we get into mental disorders in the elderly with regards to a global perspective, I want to first clear up what exactly mental disorders are. According to medicineplus.gov, mental illnesses are conditions that affect one's mood or behavior and can either be short-lived or chronic. They are characterized by a combination of abnormal thoughts, perceptions, emotions, and relationships with others, and are determined through interviews concerning symptoms. Some common examples include depression, schizophrenia, and dementia. And a little statistic about global mental disorders in the elderly is that according to the World Health Organization, it is estimated that between 2015 and 2050, the proportion of the world's population over 60 years old will nearly double from 12% to 22%, and currently, approximately 15% of adults aged 60 and over suffer from a mental disorder, which is a number that will only rise as the global population as a whole ages, which demonstrates the increasing relevance of mental disorder epidemics on a global scale. So the main idea I want to project to you all today is that mental disorders in the elderly transcend cultural and ethnic boundaries, with crises more prevalent in low to middle income countries, where they are under-identified by healthcare professionals. Existing poverty complicates accessible treatments, and cultural influences makes elderly reluctant to seek help and increases the severity of these crises. So as mentioned before, mental health epidemics are most marked in low and middle income countries, where there are very few psychiatrists and mental health professionals to adequately address the issue. According to the World Health Organization Mental Health Atlas, which surveyed the mental health resources available in various global regions, they found fewer than one psychiatrist per 100,000 people across India, China, and much of the rest of South and Southeast Asia, and fewer than one psychiatrist per million people in most of sub-Saharan Africa. In the image shown, courtesy of the World Health Organization, the shortage of full-time equivalent mental health workers in various low and middle income countries demonstrates that poverty is a significant contributing factor in the prevalence of mental health crises. So poverty is one of the most important social determinants of mental health, intersecting with all other factors such as education, race and ethnicity, gender. The list goes on. Economically disadvantaged elders are exposed to stressors such as financial instability and lack access to healthcare, and most are unable to lift themselves out of poverty through obtaining a wage-earning job. A notable statistic from the National Center for Biotechnology to give you all an idea of how poverty-stricken regions of the world are disproportionately impacted is that in 2001, it was measured that 60% of people worldwide, including the elderly, with dementia live in low to middle income countries, with the number projected to rise to 71% by 2040. Social stigma, which is defined as the disapproval of a person because they do not fit into society's standards, and discrimination remains a major obstacle to ensuring access to quality care for older people with mental illnesses. The stigma that elderly face is characterized by rejection, blame, or devaluation, which results from adverse social judgment. Cultural influences are also to blame for the intense discrimination and stigma that is directed towards elderly with mental disorders, which ultimately prevents access to knowledge and services to the stigmatized aging population. Social stigma and discrimination can make mental health problems worse and stop the elder from getting the help they need, for fear of plausible family dislocation, a definitive end to their independence, and above all, disdain towards their decisions that are not deemed socially acceptable. So, cultural differences and beliefs, which impact treatments and interventions, really explain the significant disparities in the rates of formal mental health service use among racial and ethnic minority elderly as compared with their Caucasian counterparts. In many developing countries, elders typically live with their families in multi-generational households, since the concept of living alone is alien and dreaded, and as a result are less likely to seek treatment, which could lead to removal from their family. For example, in India, the concept of aging and death is accepted as inevitable, and elders who develop mental disorders do not seek to treat their illness or improve their situation. Another example is that in Africa, the development of mental illnesses are evaluated as disruptions in social support provided by familial networks and not something requiring formal medical attention. And distrust towards mental health professionals also remains an obstacle. Raising awareness of the various mental disorders that plague the elderly can destigmatize them and help suffering people reach out without having to fear adverse social consequences. Broader global actions beyond eliminating stigma must be taken and can only be effective if the socioeconomics of differing regions are taken into account when formulating solutions. Most importantly, future development of mental care services for elders need to be modified to suit each individual country based on their unique health system's context. For example, low-income countries lack the economic and human resources to effectively instill widespread introduction of specialist services, and in this case, the most cost-effective way to manage the elderly with mental disorders are through supporting, educating, and advising family caregivers, then reforming respite care. As an individual seeking to eliminate stigma towards mental illnesses encompassing all age groups in society, you can educate yourself and others about these disorders and their causes. With regards to mental illnesses in the elderly, we can all be more aware of our attitudes and behaviors when around elderly by avoiding the installation of a helpless mindset, focusing on the positives in their lives, including older people in social circles, and helping the elderly avoid social isolation, which can in turn positively impact their mental wellness. Here are the references I used to build my presentation. And here's my contact information if you want to reach out with any questions or comments, all are welcome. I would like to thank the coordinators of the Global Health Leaders Conference at Johns Hopkins University for providing me with this exceptional opportunity to present on a topic that is very important to me. I would like to thank my family and my school counselor for supporting me in my endeavors. And lastly, I would like to thank you all for coming out today to listen to my presentation. Have a good day.